I'm here at the annual meeting of the North American Menopause Society, and I am talking with
Dr. Patricia Robertson from the University of California, San Francisco in the Department of Obstetrics, Gynecology, and Reproductive Sciences.
And you were talking, your lecture is on the care of midlife women and lesbian health.
Right. For many women, about 9% have had same-sex partner relationships at the end of life, during their current life, and we know that there are health disparities between lesbian and bisexual women versus heterosexual women. So my talk's going to focus on some of the medical issues. This is an emerging field with just very little research. However, there are some significant issues that have come to surface.
Well, let me ask you, women at midlife have special issues. What are some of the things that women who happen to have same-sex partners need to think about beyond what they would anyway?
So they need to think about how they're going to approach menopause and look at their individual risk for breast cancer. There's probably a slight increased risk of breast cancer for lesbians versus heterosexual women. The mammogram screening rate is about the same, but there are risk factors in the community such as increased alcohol use, especially up into the age of 40. Most lesbian women have not had biologic children, therefore have not had the chance to breastfeed, which can be protective if started earlier. And also, there's an increased body mass index for lesbians compared to heterosexual women. And this can really manifest itself as lesbians age in terms of knee and back problems, social isolation, mobility issues.
So there's a social component to this, but there's also a physical component to this.
To health.
To their health, yes.
Right. The Office of Women's Health sponsored recently 4 sites focused on midlife lesbians and found that during this time of life, lesbians were interested in talking about healthy eating, not loss of weight per se, but social connections with each other. A lot of times, LGBT people are estranged from their families of origin because of the difficult judgments that happen when they have come out to their families. So it's not unusual for lesbians to have a family of choice rather than have strong relationships with their family of origin. So there's a strong need for them to be in a community.
So all of these mental health components or support aspects of health are also a part of staying well and wellness in midlife and beyond.
Absolutely. The social connections found at LGBT community centers, found in sometimes bars still, although that seems to be the minority of lesbians who actually now meet people in bars. There are online communities. There are religious communities, some of whom are welcoming to lesbians and bisexual women. So especially as lesbians and bisexual women age, they need to connect to help stay well.
Well, thank you very much.
You're welcome.